everyone. Welcome to another Town Hall Facebook Live from Centro Hispano. Now, today or tonight, this evening, we will be discussing weight management, especially weight management in children and teens and obesity. And joining us tonight, we have Dr. Steve Myers and Dr. Renee Riddle. They're both from Tower Health, Reading Hospital, and we're so glad that they were able to join us this evening. We're really happy that you're here, that we're going to talk about such an important topic for our community. Usually our program runs 45 minutes and then another 45 minutes in Spanish. However, today it'll be in English in its entirety. And then after that, what we'll do at Centro Hispano is we'll edit and we'll post it, translate it and post it in our Facebook page in Spanish for those of you in our community who are Spanish speakers and are very interested in learning a little bit more about weight management, obesity, especially in children and teens. Welcome, Dr. Riddle. Welcome, Dr. Myers. And without further ado, please, Dr. Myers, introduce yourself.
I'm Dr. Stephen Myers. I'm the medical director for what used to be called the Weight Management Center, now is the Weight Loss Surgery and Wellness Center. And I've been privileged to be the director there for about 9 years now. So I know lots of people in your community, and it's been truly a privilege to care for so many people in our Hispanic community. You guys are an important and a vibrant part of our community, and we really respect what you do, and what a great thing the Centro Hispano is for your community. You guys teach us things like faith and family and love, and we are in your debt for the portion of our community that's Hispanic. So thank you so much for the privilege of being here tonight, and it's great to have Renee with us as well, and I'll introduce her in a moment. I do want to let everybody know that we recognize that the Hispanic community is hurting. They're hurting for a lot of different reasons. And one reason that they're hurting is because people that are Hispanic have higher rates of obesity and diabetes. We also know that people that have COVID-19 that have diabetes or have obesity, they're suffering more than the population that does not have those diagnoses. So we know that our Hispanic community is hurting, and that's why we're here, to be of service to anybody that is interested in being helped with weight management. Because when you help someone with their weight, often you can help them with their diabetes and their obstructive sleep apnea, their high blood pressure, and other medical problems. So it's our privilege to be a method by which they can resolve some of those problems. I want you to know that our center is prepared for Spanish-speaking people. 2 of the 3 people that work on your behalf to get approval for being seen or have an operation, 2 of those 3 people are Spanish speakers. Juana and Jenny do that all day long, and they're just great at what they do, and they're great partners in our center. So you can know that they're there to help you. We also have translated all of our manuals and our information into Spanish. We have interpreters by video and by audio to help us when that's necessary. And we see people with video so that you don't even have to leave your home, or by telephone or face-to-face when that's necessary. This has been a vision of mine for the 9 years that I've been here. I've been a bariatric surgeon for about 15 years, and I think I've been a surgeon longer than you have been on this earth, Annabelle.
I
So
don't know
I've
about
been,
that.
so I've been a bariatric surgeon for about 15 years, and the last 9 years I've been here in the Reading area. And when I first came here, I could tell that there were several things that were needs here, and one of them was care for teens and children for their overweight or obese status. So it was really a wonderful privilege to work with Tower Health to develop a program for uh, children and teenagers that are suffering because of their weight and suffering with their weight. So about 9 months ago, Dr. Riddle joined us, and she's a very experienced pediatrician and also board certified in obesity medicine. So she joined us so that we could start seeing children and adolescents and helping them with their weight issues. So I just want to introduce to you Dr. Renee Riddle, and she has prepared some things for us tonight.
All right. Thank you, Steve. As Steve said, I'm by training a general pediatrician, and I have been in the Reading area for almost 15 years now. I've always seen a lot of patients in my general practice with weight problems and have felt that it's important to help them. And then I was approached about this position and starting working at the center back in November. So I'm going to give you a little bit of a view of our center, and then we'll open up for questions. Give me a second to get my PowerPoint going.
While you're getting your PowerPoint going, I just want to say that it's really important that our community knows that you have personnel that speak Spanish. And also in these times of COVID, if somebody needs to make that appointment via, the telemed, through computer virtually, I think it's also good to know, because I think that sometimes our population is a little hesitant about going sometimes and seeking help if they don't know that there's somebody there that speaks their language that they can relate to.
Yeah, that, like Steve said, we have interpreters, we can use video, we can use audio, whatever is preferred. And we can do the visits both in the office and through telephone, video, whatever works. A lot of my families like to come in because they like to be in the room with the interpreter, the parent, and the child. So sometimes in person is easier, but we do three-way calls, we do video, we kind of make it work, and we try to be as flexible as we can because we want everybody to feel comfortable and understand what's going on. So our program originally it was called the Healthy Teens Program. We started out only seeing teenagers, but quickly we saw the need for all ages, and we've expanded into the Healthy Kids Program now. And so we can see anyone with a body mass index or BMI that is greater than 85th percentile for age. And if the child is 15 or older, they can be considered for a surgical procedure if appropriate. Body mass index, most people I think today are familiar with. BMI. It's the way that we measure healthy weight. So some people are short, some people are tall. Obviously, somebody who's 5 foot is going to have a different healthy weight than somebody who's 6 foot. So body mass index puts it all into perspective. In children, we look at growth curve, so it's a nice visual way. If you're down here at the bottom, you're underweight. In the green would be healthy weight. In the yellows, kind of caution, borderline overweight, and that's when we can start seeing any patient. And then up in the red would be into the category of obesity. So what does our team consist of? We have myself as a pediatrician, Dr. Myers as bariatric surgeon. We have multiple dietitians that can work with the family. We have a psychologist that can evaluate the child and family and work through any kind of mental health or behavioral problems that they're having. We have specialized nurses and support staff. The office is all friendly and sensitive to weight sensitivity. We have appropriate staffing and support for everyone. And it's a place where we want people to feel comfortable. As I tell everybody at the beginning of every visit, we're not here to judge. We're just here to help you. And, coming out and deciding to talk about your weight is hard for a lot of people. And we're just excited you're taking that first step. So we look at the potential medical problems and we can help sort out and treat them. There might be high blood pressure, cholesterol, might have sugar problems or diabetes, triglyceride or high fat levels. Some people can have something called fatty liver, which is the fat deposits in your liver, which is an organ that can be dangerous. There can be sleep apnea. There can be psychological problems with kids in school. They might be having bullying. They might feel like they don't want to go to school. Our psychologists can help there if needed. And there might be school problems. So sometimes we can help get those evaluated and help the family be more successful. Our goal is to create an individualized plan. There's no one size fits all. That's what works for the child and the family. And we work with the child and the parent or guardian, whoever is present, to make some nutritional changes, lifestyle changes, work on some of the behaviors, may include some medications, and then bariatric surgery if needed. It's a very team planning, individualized plan. We might need to involve other medical specialists as needed or specialized testing, and our center can help coordinate that as much as possible. And then Dr. Myers, if you want to just talk a little bit about surgery options.
So different operations have been used for teenagers in our program. People that are 15 years or older could be candidates for having a bariatric operation. And the people that meet criteria are usually teenagers that have a body mass index over 40. And all of these three different procedures that you see on the screen have been used to help children and adolescents to lose weight and get rid of their medical problems related to their excess weight. The one in the middle is a gastric sleeve, and that's the one that is probably most frequently used for teenagers today. And in fact, we feel like that's the best option for most teenagers that need to have something done surgically. A gastric band that you see on the right-hand side has been used in the past, but that's pretty much no longer used. And it's recommended not to use it for teens any longer. So it's not an option for people, but I just put that on there because some people have had gastric bands, adjustable gastric bands to treat their obesity, and that would include some teens. The picture on the left side of your screen is a diagram of a gastric bypass that has been used and probably still is being used sometimes to help people that are teenagers, but it requires a level of compliance that may be difficult for adolescents to deal with, especially when it comes to taking the right amount of vitamins and things like that. So in general, a gastric sleeve is probably the best choice for adolescents today. Can I see the next slide also? Okay. So I'll answer other questions about that after Dr. Riddle completes her PowerPoint.
So also as part of our office, we do have dietitians who can offer nutritional education to the family. We make sure each child and guardian parent sees the registered dietitian at least once. We have a couple different ways and methods that we can do this. And then depending on the needs and desires of the family, we set up visits for ongoing support as they feel interested and it works in their schedule. Our dietitians also are able to do virtual visits right now, if that's what works. And then once COVID calms down, we look to returning to some opportunities for group education, group classes, and hopefully in our teaching kitchen that we have to eventually have some skills-based learning there. The techniques that the dietitians use are things like mindful eating, be aware of what you're eating, how to read food labels and understand them, food journaling, so keeping track of what you're eating, meal planning, so planning ahead of time, what you're going to eat through the week so you can go to the grocery store and have the right stuff on hand, giving ideas for healthy meals and snacks. And we work with the family, the foods they like, the foods that they have at home. If accessibility, quickness is a problem, they can work with some of that. Looking for also in what financial needs they have for the foods. And we can look at some community resources if needed. We do have some help that we can get the family and some community supports. And then cooking skills and just balanced nutrition. We participate with most major insurances in our area. Pretty much almost everything the hospital takes, we take. If you had any questions about insurance, you can call Patient Financial Services. You can also look online at the list. And then we have patient representatives in the office that can help schedule an appointment if anybody was interested in coming. And then their number is here. And we have a website out there. We are located out by Target off of Broadcasting Road. And this is our phone number. So that kind of concludes the PowerPoint piece, and we can go to questions.
Okay. Okay, that was really interesting and informative information about the work that you do for the community, especially for children and teenagers. Now, let's start with, let's say, the beginning, prevention. How are ways that we can establish healthy eating habits as a family for children, for the teenagers, for adults? What would you recommend?
Right. So when we talk about prevention, starting from the very beginning, even when an infant is born, that's why breastfeeding is the best, because it's truly on-demand feeding. We have no idea how much that baby's getting. And so just letting them get what they want when they need it. It teaches a child how to be full, how to ask for food, and how to know that the need will be taken care of. So starting out as early infancy, we support breastfeeding as much as possible. If not, bottle feeding is an option. Just being aware of how much they're getting. We can, being aware of their cues. Remember that crying doesn't always mean hunger. It also can mean other things. Avoiding starting solids earlier. In infants, we talk a lot about really in the bottle, it should just be milk. We don't want to put foods in the bottle, cereal. Those are not meant to be drank, and it just teaches early on to consume extra calories. So when it's the appropriate time, around 6 months, to actually sit in a high chair and spoon feed fresh fruits and vegetables, just basic healthy foods. So starting out early, setting up those eating habits. Making mealtime a routine and a set habit that the family does together, participating in it, sitting at the table together, not having distractors, turning off those screens, turning off the electronics, actually sitting and talking to each other at dinner, which is hard because we all have very busy lives. But we know that research-based families that eat together have a lot less problems, even behavioral problems. And it's a time to share your day. At least that family dinner meal may not work out for all 3 meals, but having at least dinner together as a family. Parents also complain, well, the kids are picky. They don't like what I cook. And so we talk about strategies to get kids to eat new foods, generally making 1 meal for the whole family. Best way to get kids to eat new things is to encourage them to try it. You don't want to force feed because that can be problematic on its own, but just getting a taste. So at a meal, if you make 1 item that everybody in the family likes, make it a balanced meal, put a little bit of everything on that plate. Encourage everybody to try it. And even if the adults are picky eaters, they have to do this too, to model to their children. Once they taste things, then they can choose what they'd like more of. This gives some control to the child, And it's teaching that family meal and that everybody kind of eats these healthy foods together. So modeling by the parents and sitting and spending this time can be very helpful.
Let's talk about the 5210 rule for healthy eating.
Okay. So, one thing we talk about is just what is base healthy eating. So, when we come in and when my patients come in and see me, they obviously already have some weight issue, but we're not talking about doing something dramatically different for this child. We're talking about just setting up some ground healthy nutrition, healthy living, lifestyle changes. And the 5210 is a good rule to follow. And it's for everyone. It works for adults, it works for kids, but generally what you want to get is 5 servings of fruits and vegetables a day, 2 hours or less of screen time. Now, in the area of COVID, that may be a little bit longer. That doesn't include educational time. It doesn't include interactive time. Like this would not count because this is interactive with people, but it's just that watching and not interacting, not doing anything, trying to minimize that. An hour or more of physical activity a day. For the younger child, it's just going outside and playing. So try to get outside. And so we work with families. Not everybody might have a safe yard. We work with alternatives if they can't get outside, how to free play in the house that at least keeps them active. And then 0 sugary beverages. We consume a lot of calories through our drinks. So trying to cut out all sugary beverages, which would include juice, which would include Gatorade, iced tea, soda, trying to minimize these and cut back to eventually 0.
Ideally, what you want to do is drink water, correct?
Correct. So, water, there are some of the flavored waters. Those are a better alternative, although plain water is the best. You can flavor your own water, put some cucumber in it. You can play around with herbs, some mint, some basil. It really doesn't matter, lemon, lime, whatever you like personally. And so encouraging families to kind of experiment with some of these things too, and the child can get involved and help make it too.
You mentioned exercise. What would you recommend right now as far as exercises indoors, especially now with everything that's going on with the COVID? And a lot of families are spending a lot of time indoors. And I would figure they're probably depending on the phone, the computer, the television. What would you recommend as healthier activities?
So, just some basic healthy things like you can do dancing together. A lot of families like to dance. So you can play a simple game of freeze dance, play some music, everybody dances. When somebody turns it off, you stop. If you do this for 15 minutes, 20 minutes, it's a level of activity. A lot of the kids are into the YouTube workouts. And so encouraging them to look at them maybe with their parent, do some of these together. If they don't like doing that workout, they can create their own workouts and being very creative. So trying to set a 15-minute routine of exercise. So it could be 5 sit-ups, 5 push-ups, 5 flights of stairs, and then you kind of repeat it, just working together as a family to come up with some kind of routine moving around that you could do. You can make rules in the house like, okay, if you want a snack, you have to do 3 flights of steps before, not as a punishment, but just make sure you really want it. Are you bored or are you really hungry? So let's just do a little bit of activity. You can play games like Follow the Leader, Simon Says, if you just have a little bit of space in the house and it gets some interaction. In the younger kids, it teaches them how to follow directions, and it's a fun way to all be together as a family.
Let me ask you this. You mentioned when you were talking about food and food intake and beverages. There are a lot of juices out there right now with artificial sweeteners. What would be your take on that? Your recommendations about artificial sweeteners? Are they safe for children?
So this is probably one of the more complicated, controversial topics, but in general, they are not recommended for children. So we don't know specifically of harms, but there are definitely concerns. There's been a lot of research that maybe they make you crave more sugar. So a lot of the artificial sweeteners work in the brain and the same receptors that sugar work. And there is some rebound that you are actually more craving a sweet afterwards. So they may actually increase your intake. There's been some research that they increase insulin or make you a little more prone to having pre-diabetes, people talk about. And so that would be another reason against them. Now, some of these don't happen to everybody. They've not been really studied well in children. We know that excessive weight gain is bad. So sometimes it's a balance. If you have a child who absolutely you cannot get them off soda, and one diet soda a day calms them, it can be used as a transition, but we really don't recommend long-term use of the artificial sweeteners. We recommend as minimal as possible. There are what are called natural sweeteners out there, which are sugar alcohols, and these are put in a lot of products now. They are probably better. They have no known health effects at this point, and if you're going to pick one, those are um, the recommended sweeteners. They're things like ethanol alcohol, they're called, and they usually have some alcohol in the end of them. And it'll say natural sweetener, not artificial, although we know the best is just having water on its own, but trying to balance this risk out.
What about stevia? We hear so much about stevia being recommended, the plant and the
Yeah.
sugar. What is your recommendation?
It's probably better than the artificials, although there's some controversy over stevia too, very highly. Again, it's a whole balance. It's probably better than NutraSweet, but it's not it's not considered as good as the sugar alcohols right now. Some countries have banned stevia at different times because there were some concerns about its health. Right now in the US, it is used. There's not, again, a lot of good data on kids. So we generally recommend stay away from sweeteners as much as possible. If it's going to reduce some calorie, we know weight causes big problems, and some of the data on the sweeteners is artificial. Probably stevia is better than NutraSweet because it is at least in a plant family. But the sugar alcohols would be what we recommend the most if you're going to do a sweetener.
And then what is the right age to address weight in children? Especially because we're in our population of the Latino community, we love food. We interact with food. We engage with food. Here, child, eat. You have to eat everything that's on your plate. What's the right age when you have to start thinking there might be a weight issue with my child?
Right. So I think that always, I think it's really important. Hopefully, people are going in for some kind of routine care with their family physician, their pediatrician, whoever their primary care provider is. And once a year, when you go in for your checkup, you should be getting a height, a weight, and a body mass index, and looking at that number and addressing it in a very sensitive way. Also, talking about nutrition, talking about how to set up these habits early in life. It is much easier not to become obese than it is to be obese and lose weight. So if we can catch it early, if we can catch those kids in that overweight category where they're just starting to show some signs of increase, that can be very beneficial. So I don't think we shouldn't wait. And a lot of people do believe in just waiting. I mean, Hispanic community loves their little chubby babies. And so trying to address from the beginning and talking all about healthy weight. And sort of what I think is difficult for families to understand is babies generally are chubby. They go through a period of being naturally chubby. And then when we look at the growth curve, as you hit toddler years, it kind of goes down. So your body mass index actually decreases in early elementary age, and you do get thin. And people hate this. They think they're very flacco and thin, and they feel like they're starving their child, but showing them on the curve that it is a very normal finding. And school age children right around kindergarten, first grade are supposed to be thin. When we look at the data and we look at studies, we know that if they don't follow that, they don't become thin, but instead they keep going up, they are much more likely to become an obese adult. The older you are when you carry obesity, the more likely you are to continue. And if you are obese as an adolescent, your chances of obesity in adulthood are very, very high. And we worry about disease burden. So if you're starting with obesity at 10, and maybe getting diabetes at 12. This is a lot more years of damage on your body. And so prevention is definitely the way. Trying to set up these eating healthy habits as a family, eating together, adding vegetables, learning different ways to cook. Which is hard because people have learned how they cook from when they were little. And some of it is changing styles. Like you can have rice, but it shouldn't be the whole meal. So cutting back on some of that, baking more than frying, being creative about that kind of stuff.
And I think that's really important, especially with our Latino community, because we do love rice and
Mhm.
beans and fried meats and foods. We do love that. So it's also good to know. Thank you. Now, I'm going to address Dr. Myers because I have a couple of questions for you. When we talk about the surgeries that you were mentioning, bariatric, I believe you mentioned also the gastric sleeve. What is, I guess, who's eligible for those surgeries? And then at what age would you start or be eligible
So
to have those?
I think if somebody is reaching the level of a body mass index of 40 or greater, and they turn 13 years of age, a consideration would be to come into the center, meet with Dr. Riddle, work through the process, and by the time they're age 15 and they're still struggling and not making progress, that would be a time to seriously consider having an operation of somebody who was that size. And I'll just give you an example. Let's say your child is 5'4". I'm reading it off of a chart here. 5'4", and they are 230 pounds or heavier. That means their body mass index of 40 or heavier. If they're a younger child, maybe they're only 5 foot, they would meet criteria for a bariatric operation when they were about a little over 200 pounds. Of course, I see teens sometimes that are over 6 foot tall, and they can carry a lot more weight. But if somebody was 6 foot tall, they would meet criteria for these operations generally when they were about close to 300 pounds. So it varies with their height. That's what the body mass index does. Once they get to that size, the chance of them losing significant amount of weight and keeping it off without an operation goes down lower and lower. And the higher their body mass index is, the more likely it is that they're not going to be able to lose weight, enough weight, by diet, exercise, even medications. We'd like to have them try to do that. But if they're in our practice, if they are 15, they can be operated on. This month, we've done 2 teenagers at the Reading Hospital, and they're both about 17 years of age. And most of the children that we will care for with a body mass index of 40 or above will also have medical problems like Dr. Riddle mentioned. So they are eligible because of their age, because of their weight, and also if they have medical problems like insulin resistance or diabetes, high blood pressure, they're on medication for that already, and if they have obstructive sleep apnea, they have to use a CPAP machine to sleep at night to keep their oxygen levels where they should be. These are indications that these children are being severely affected by their obesity, and it's time to get something done because you don't want your child to have diabetes for 10 years before they're even adults, because children are actually more sensitive to diabetes and the side effects of diabetes than adults are. So those are the people that I would say are eligible. There are places that have done children younger than 15. It's just the level that we feel comfortable with at Reading Hospital. Someday we do have a relationship with St. Christopher's Hospital now. That's part of Tower Health in Philadelphia. And there may be a day when we operate on younger children that are of extreme need at that institution, but that's not a reality yet. But it is a project I'm working on to see if some of the children that might be 9 years old and they're already showing these things and they're very large, maybe they need earlier intervention. So that just gives you a picture of what I think about when I look at someone and evaluate whether they're eligible to be considered. Of course, there are other things in that they can't have severe untreated mental illness and some things like that. But basically, if they're a body mass index of 40 or above and showing, especially if they're showing signs of medical illness related to their obesity, they could be considered.
Okay, that's good to know. I guess if somebody seeks surgery, what do you do? What is it that what are the steps to follow in order to get the surgery for teenagers?
So the first thing I would say is that Dr. Riddle evaluates every child, every teenager as well. Whether they go to surgery or not, she's going to be evaluating every child, and she will talk with them about their various options, like structural changes in their diet or structural changes in the family eating habits, and a lot of other things. She also would consider for some children medications that can help. And then sometimes she would say, you really need to at least consider having an operation because your weight is at such a level that you either are already experiencing evidence of medical problems from your diabetes, from your obesity, or you're so likely to do that, you really need to get something done. So that's the first thing I would say, is they meet with Dr. Riddle, let her help to guide them as to which direction they may need to go. Once they have made a commitment that yes, they do want to go towards surgery, then it looks a lot like an adult pathway. And that what I mean by that is they need to be seen by a psychologist to make sure everything's okay there. They're going to see a dietitian usually 3 to 6 times before their operation, and that takes 3 to 6 months. They would be seeing me for an evaluation as well and get laboratory work done. Sometimes they would have special studies done as well. And then after they've completed everything and all of their medical problems are improved as much as possible, then they would be considered for surgery, and Juana or Jenny would get approval from the insurance company, and then we can go forward with their operation. Does that help?
Yes, that definitely helps. How long is the recovery after that surgery?
So generally, people are just in the hospital. The teen would be in the hospital over one night. And then by the afternoon, the next day, they're ready to go home. And they'd be back to full activity, back to school, back to sports and everything in about 3 weeks. So I think, there is a continuous process afterwards of them changing their diet until it gets to a normal diet, but they're back to full activity in about 3 weeks.
I think that's really good to know. The recovery process is fairly quick, and they can get
Yeah,
back.
I think it's quick. And, we've done a few things, Annabelle, to help our teens. One is we have anesthesia do a certain form of additional pain relief, which is while they're asleep, they get a shot on each side of the abdomen. They don't feel that at all. When they wake up, they really don't feel a lot of pain. So that's very helpful. And there's several things that we do. We make sure that everybody that comes in contact with the child has clearance for child abuse and education in child abuse, so that that's taken care of. There are just several things that are unique when a teenager comes through the process, but it looks pretty similar to an adult process.
Let me ask you this. I have a question from one of the viewers. The question is, are weight surgeries being done again, or being done now during COVID?
Yes. So we took about a 3-month pause, and then we started carefully to make sure we were protecting everybody and checking everybody. All of our patients get tested ahead of time to make sure they don't have COVID, and then everybody's masked and gowned and gloves, and use lots of hand sanitizer and all those types of things while they're in the hospital for that short time. So we started that at the beginning of July once again, and now we're back to pretty much a full schedule because we've been able to demonstrate that they can come in, have their operation safely, and be able to also be in the hospital for that 24 hours and be safe. So I think the hospital has made adjustments so that we feel comfortable now doing that. And I think that's a personal choice that the patient and family has to make. But yes, we are doing bariatric surgery now.
What do you recommend? We're reaching, we have about 2 minutes left of our show tonight. What do you recommend someone who might be struggling with their weight, who's a little fearful about seeking help? What would you say to them?
For an adult, they can go to our website and do a information seminar to understand about the operations and what they would be getting into. We're in process of doing that for our adolescents as well. So I think that would be what my recommendation would be.
Dr. Riddle, what would be your recommendation for the people that are watching this show tonight in our community, as far as what to do if they're struggling with their weight?
I think call and set up an appointment, come and talk to us. Some people are really ready after they talk to us, some people are not, and that's okay. When I see the family for the first time, we figure out a follow plan that works for them. Some are very, very ready and they want to come see me every 2 to 4 weeks, and we do that. Some are like, I'm not so sure, I don't want to come back for a little bit. They come back in 3 months. And so, come in, meet us, be very flexible. A lot of times the whole family engages in our center, because it's not uncommon that multiple people in the family have obesity. So I see siblings together often, and we're flexible about that. I can see them at the same time to make it easier for the parent. And then oftentimes the parent engages in care with one of our adult providers also. And then the same thing happens where a parent comes in and is talking to one of the adult providers and is worried about their child, and they help them get an appointment set up with me. So, it is a safe center. I think most people are very happy when they come in, and just try if you're ready and come see what we have to offer.
Thank you. Thank you both. I want to thank Dr. Riddle. Thank you, Dr. Myers, for bringing us this important information about weight management and also surgeries, the potential, especially in our with children and teenagers. Thank you. Really appreciate that you've taken time to join us tonight. And I want to remind our community to continue to stay safe. Please continue to wash your hands, practice social distancing, wear your masks. And I also want to remind our community that if you haven't filled out the census, it's so important for you to do so. Please call us at 610-685-1260 or 610-685-1265 if you would like some assistance with completing the census. Once again, thank you both. We appreciate you joining us tonight. This has been a wonderful chat, and we'll be posting this on our Facebook page for everyone to view. Thank you.
And nice to be with you, Annabelle.
Thank you.
Thank you for inviting us. Have a good night.
Good night.